Have ketamine go in 2000 based on the fact that NMDA receptors had been implicated in depression and the fact that ketamine is an NMDA receptor antagonist. Robert Berman and his team of 6 other researchers went ahead and conducted a small clinical trial with ketamine, just 7 patients. And within hours of a single sub-anesthetic dose of ketamine, most of the patients experienced a dramatic improvement in their depressive symptoms. Since then, repeated larger trials found more of the same. Within hours, severely depressed patients treated with ketamine experienced significant improvements in their symptoms, with the effects lasting up to 2 weeks. Ketamine treatment has also been found to help reduce suicidal ideation and anhedonia, both common symptoms of severe treatment-resistant depression. After almost 2 decades of additional research, the FDA approved Spravato, an intranasal spray containing a form of ketamine, as a therapy for individuals diagnosed with major depression that hadn't responded to 2 or more traditional antidepressants. And scientists have been working on better understanding how ketamine produces this effect and how to best apply this treatment ever since. When a person takes ketamine, a bunch of stuff happens. When used recreationally, which usually involves insufflation or snorting the drug, the effects typically kick in pretty fast, within about 5 to 20 minutes, and it has a relatively short high of about 30 minutes to an hour. Ketamine raises blood pressure and heart rate, and at a high dose, of course, it acts as a dissociative anesthetic, rendering a person essentially unconscious for the duration of their treatment. Now, at lower sub-anesthetic doses, it can have a number of psychological effects, including feelings of intoxication, changes in visual and auditory perception, delusions and hallucinations, and difficulty speaking and moving. People who take ketamine recreationally describe it as euphoric, dreamlike, relaxed, and chill. I've heard people say that it can be buzzy or sparkly. The side effects can include feeling confused, disoriented, and nauseated. It can also dull your sense of pain, making it hard for you to tell if you've injured yourself. Sometimes, if a person using ketamine takes too much, they can fall into a K-hole, which means that they become unable to interact with the world around them because they've taken so much ketamine. And while ketamine has less of an effect on the cardiac and lung functions than many other anesthetics, you can fatally overdose on it.